After reaching the summit, we now try to look at what happens to the body when it is brought to the stratosphere. The stratosphere is very dry. Air in this area contains little water vapor, and because of this, few clouds are found in this layer. Almost all clouds occur in the lower, more humid troposphere. Ozone, an unusual type of oxygen molecule that is relatively abundant in the stratosphere, hits this layer as it absorbs energy from incoming ultraviolet radiation from the sun. Temperatures rise as one moves upward through the stratosphere. Because of this temperature stratification, there is little convection and mixing in the stratosphere, so the layers of air there are quite stable. Commercial jet aircraft fly in the lower stratospheres to avoid the turbulence which is common in the troposphere below. So here's a trivia. So MiG-25, the fastest manned interceptor and reconnaissance aircraft ever to enter service, was designed by the Chinese, the Russians, the Americans, or the Israelis. The maximum speed of these aircraft reaches 3,494 kilometers per hour, or what is now known as Mach 2.8. And the highest altitude reached by this aircraft is around 37,500 meters. So your MiG-25 was produced by the Russians. So what is a Mach number? Mach 1 refers to the point at which an aircraft exceeds the speed of sound, creating a sonic boom. What is the exact speed of sound? That question is more difficult to answer than you would think, as the exact speed of sound is dependent upon a variety of variables like the current, temperature, and air pressure of the air that surrounds the sound is passing through. Here's another trivia. As an airplane approaches the speed of sound, the sound waves that are emitted by the plane itself cannot get ahead of the plane. This causes the sound waves to pile up and accumulate in a cone of sound, which forms directly behind the aircraft. As the aircraft passes an area, all the accumulated sound is released at once as the cone of sound expands rapidly. And this is the mechanism that creates sonic booms. Because of rapid changes in velocity and direction of motion in airplanes or spacecraft, several types of acceleratory forces affect the body during flight. At the beginning of flight, simple linear acceleration occurs. At the end of flight, deceleration occurs. And every time the vehicle turns, centrifugal acceleration occurs. G-forces are the forces of acceleration that pull on you when you change your plane of motion. The G-force from such maneuvers as pulling out of a drive or banking sharply are called positive Gs because they increase our ordinary sense of gravity. It is also possible to maneuver in a way that produces negative force of gravity, and these are called negative Gs, and they have a very different effect on the body. The force of gravity when you sit, stand, or lie down is considered 1G. In normal activity, we rarely experience anything other than 1G. When an aviator is subjected to positive G, blood is centrifuged toward the lowermost part of the body. Thus, if the centrifugal acceleratory force is plus 5G and the person is in an immobilized standing position, the pressure in the veins of the feet becomes greatly increased to almost 450 millimeters mercury. In the sitting position, the pressure becomes nearly 300 millimeters mercury. In addition, as pressure in the vessels of the lower body increases, these vessels passively dilate so that a major portion of the blood from the upper body is translocated into the lower blood vessels. Because the heart cannot pump unless the blood returns to it, the greater the quantity of blood pulled in this way in the lower body, the less is available for the cardiac output. If you continue to pull high Gs, the G force will push the blood in your body towards your feet and resist your heart's attempts to pump it back up to your brain. You will begin to get tunnel vision, then things will lose color and turn white, and finally everything will go black, and you've just experienced the onset of gravity-induced loss of consciousness, or GLOC. Extremely high acceleratory forces for even a fraction of a second can fracture the vertebrae. The degree of positive acceleration that the average person can withstand in the sitting position before vertebral fracture occurs is about 20 G. If you're flying straight and level and push the nose of the plane down, you will experience your weight lessening. The harder you push the nose down, the more weightless you will feel. You are now experiencing negative Gs. The effect of the negative Gs is to push the blood up into the head, just the opposite of positive Gs. The effects of negative G on the body are less dramatic acutely, but possibly more damaging permanently than the effects of positive G. An aviator can usually go through the outside loops up to negative acceleratory forces of -4 to -5 G without causing permanent harm, although causing intense momentary hyperemia of the head. Occasionally, the psychotic disturbances lasting for 15 to 20 minutes occur as a result of brain edema. Occasionally, the negative G forces can be as great as -20 G, and centrifugation of the blood into the head is so great that the cerebral blood pressure reaches 300 to 400 millimeters mercury, which sometimes cause small vessels on the surface of the head and the brain to rupture. As a result of large negative Gs, some blood vessels in the head and the brain may rupture. However, the vessels inside the cranium show less tendency to rupture than would be expected for the following reason. The cerebrospinal fluid is centrifuged toward the head at the same time that the blood is centrifuged toward the cranial vessels, and the greatly increased pressure of the cerebrospinal fluid acts as a cushioning buffer on the outside of the brain to prevent intracerebral vascular rupture. Because the eyes are not protected by the cranium, intense hyperemia occurs in them during strong negative G, and as a result, the eyes often become temporarily blinded with what is called red out. There are two main strategies to prevent the detrimental effects of G-forces that aviators usually use. One is through the anti-G straining maneuver, or AGSM. The AGSM increases aortic blood pressure, maintaining brain perfusion and pilot consciousness. Well-trained, effective AGSM can increase G tolerance by approximately 3 Gs. AGSM can be achieved by the following maneuvers. Number 1, breathing should be rapid. Acceleration and inspiration cycles every 3 to 4 seconds. This maintains oxygen content and decreases carbon dioxide in blood while also relieving increased pressure of chest and allowing the heart to refill with blood. The second maneuver is isovolumetric contraction, and these consist of flexion of skeletal muscles of the legs and abdomen, and this step increases pressure in the chest and displaces blood away from these contracted muscles into the arms, chest, and brain. Pilots also use special anti-G suits which have been developed to prevent pooling of blood in the lower abdomen and legs. The simplest of these applies positive pressure to the legs and abdomen by inflating compression bags as the G force increases.